This is the Intravenous Therapy Skills Evaluation. Your objective is to demonstrate appropriate selection and preparation of a vein based on prescribed use and type of IV therapy. Demonstrate preparation and perform IV insertion. Calculate flow rate. And discontinue IV therapy and document on appropriate forms. Do you have any questions before we begin?
No.
Begin when you are ready.
First thing I'm going to do is verify the provider's orders and calculate the flow rate for my patient. The equipment I will need for this procedure includes an SF600 or local form, IV solution, IV administration set, 2x2 gauze, transparent dressing, tape, IV catheters, antiseptic swabs, a pen or marker, a tourniquet, clean gloves, a chucks pad, and a sharps container. Hello, sir. I'm HM3 from Mono, and I'll be assisting you today. Can you please confirm your full name and date of birth for me?
My full name is Benjamin Martinez, and I was born February 20th, 1995.
Thank you. So your provider has ordered that you receive normal saline at 1,000 milliliters an hour through the intravenous route. Do you have any questions before we begin?
No.
Before going any further, I'll perform hand hygiene. Before we begin, I'm going to ensure the 6 rights of medication administration, which are the right medication, the right dose, the right time, the right route, the right patient, and the right documentation. Next, I need to prepare my IV bag and tubing. I'm going to be checking for clarity, any leaks or particles, and the expiration date. Next, I'm going to aseptically insert the tubing spike into the IV bag. I'm going to fill the drip chamber so that it is 1/3 to 1/2 full. After that, I'm going to release the roller clamp to flush the air from the tubing. Once the air is flushed, I'm then going to clamp the line again. Next, I need to label my bag. I'm going to label the solution, the date, the time, and my initials. In preparation for securing the IV site and tubing, I need to have my transparent dressing and tape at the ready. I will again perform hand hygiene and don clean gloves. All right, sir, now can you extend both of your arms for me?
Yep.
Okay, you can relax this arm. After placing the absorbent pad under the patient's arm, I'll attach the tourniquet 4 to 6 inches above the selected site. Sir, can you make a fist for me? Once I've selected the site, I'm going to release the tourniquet and prepare my supplies. Now, I'm ready to reapply the tourniquet and relocate the vein. I'm going to cleanse the site by using an antiseptic swab. I'm going to clean outward in a circular motion 2 inches in diameter. While the site is drying completely, I'm going to prepare my IV catheter and inspect the tip. Before inserting the IV, I'll use my thumb and forefinger to secure the vein and pull the skin taut. I'm going to insert the needle, bevel up at a 10 to 30 degree angle. I'm going to observe for blood return in the flash chamber. I'll then lower the catheter needle until almost flush with the skin and advance the catheter off of the needle to thread into the vein until the hub is almost at the insertion site. With my non-dominant hand, I'm going to occlude the vein, release the tourniquet, remove the needle, and place it into the sharps. I'll then quickly attach the IV tubing to the site. With the connection secure, I'll open the clamp slowly to begin the infusion, and I will adjust the flow rate. I'm also going to observe the site for any signs of complications, such as swelling or leaking, which would indicate that the site is not patent. I will then secure the infusion site with my transparent dressing and tape. After that, I'm going to loop the IV tubing and secure it with tape. I will then label the dressing, writing the date, the time, the needle gauge, and my initials. After cleaning up and performing hand hygiene, I'll finish by documenting the procedure on the SF600 or local form.
The provider has now ordered that you discontinue the IV.
First, I'll verify the provider's orders. Then, I'll gather my equipment. Hello, sir. I'm HM3 from Mono, and I'll be assisting you. Can you please confirm your full name and date of birth? Okay, so your provider has ordered that we remove your IV. Do you have any questions before we begin?
No, I don't have any questions.
Before going any further, I'm going to perform hand hygiene and don clean gloves. I'm going to start the procedure by first clamping the tubing line. Next, I'm going to remove the transparent dressing and the tape. I'm also going to assess the site for any complications such as infiltration or phlebitis. I'm then going to place my 2x2 gauze over the site while slowly withdrawing the catheter. Can you apply some pressure for me, sir? I'm then going to inspect the catheter tip for length and intactness. I will then secure the gauze by placing tape over the site. After cleaning up my supplies, I'm going to perform hand hygiene. I will then document the procedure on the SF600 or local form.
Congratulations. This concludes your IV therapy evaluation.